My name is Kristine Hennings. I'm the Director of Employee Benefits for Hy-Vee, and I'm here in place of Sheila Lang, who is actually the person listed in your program. She was unable to attend today, so asked me to come in her place. And to give you a little background on Hy-Vee, we are a self-funded plan. So we have about 15,000 employees participate in our benefit plan, and we cover about 32,000 lives. How that equates back to our industry, the retail industry, to give you some perspective, if we sell a loaf of bread for $1 to you or to me as the consumer, we make about 1 cent of profit on that. So it costs us 99 cents to buy it, to put it in a building, to have people there to put on the shelf, and to sell it to you at the cash register. So I want to get that into your head about how our industry works as far as our profit that we use to run our business. Our plan, our benefit plan, costs $100 million a year. That's our 2010 budget was $100 million for medical and pharmacy. We split the cost with our employees 75-25. So Hy-Vee Inc. pays $75 million. Our employees contribute $25 million to their benefits. And I do think my slides are going to come out. So maybe you'll get to see the chart after all. All right, there's the chart. Very, very easy to read and to understand, right? The reason that we show this is of particular interest and very important to us as a self-funded plan as we begin to build our plan design going into 2014 and whether we will continue to offer benefits or whether we will not continue to offer benefits. That's a decision that we will have to make in the next upcoming years. It's not a decision we want to make, but it is a decision we will be forced to make. To give you some insight, our average full-time employee makes about $34,000 a year. Okay, that was 2009. That equates to about 5.8% of their wages to pay for their benefits. That's how it equates within 2009 for our exact numbers. With this poverty threshold, if we offer benefits in 2014, we can be penalized if an employee pays too much of their earnings to pay for their insurance benefits. So essentially what's going to happen with us in 2014 is the insurance exchange will become our competition for offering benefits. Summary of possible costs. The one thing I want to point out on here is you see includes 5,182 part-time employees. The law states if somebody works over 30 hours a week, they need to be offered your insurance. Now, that does not take into account that we have part-time employees and we have regular time employees and we have full-time employees. It's 30 hours regardless of their classification within your own payroll system. In the month of May, we had 5,000 part-time employees work over 30 hours a week. Now, we're the retail industry. It's starting to be summer. This number creeps up quite a bit in the summer months because we do have college students who want to work more. They want to work more than 30 hours a week. They want to make some money. So the number is a little skewed for this month, but we use it just to show the impact that that would have on our contribution cost as the employer. Currently, right now, as of last month, it was $76 million that we were contributing as the employer to our employees' benefits. If we make no changes to our plan, so no increases for trend to cover costs, etc., and we add those 5,000 employees, we'd be at almost $104 million in costs in 2014 when we add those employees. Now, I'm not saying that every one of those employees is going to need to be covered. Like I mentioned, those college students, they're most likely going to opt out of any insurance we might offer them. And I'm also not naive in thinking that there aren't employees who do work over 30 hours a week and should have our benefits. I don't disagree with that either. So that is kind of a volatile number, but it's just something to look at, and it's a chart that we show when we talk with our executives and our directors and our managers. The penalty, as it sits right now, would be about $44 million for us to not play, pay or play. So to not pay, we'd pay about $44 million. When you look at that on the surface, it's kind of like, well, why would you pay, Why would you play? You'd pay the penalty. But what we think about when we have to take into consideration is then, how do you recruit your talent to come work for you? How do you change your compensation to make up for the lack of providing benefits? How do you make sure that your employees are staying healthy and getting the information and the education they need when you don't provide a benefit structure? So those are questions that we're looking at as we look at 2014. This chart right here shows medical costs. So you can see across the bottom is age, and then health insurance premium runs across this side. So the blue line is the cost for males, the red line is the cost for females. The green line that you see there is the average cost for an employer group to provide insurance. It's a static line, does not increase with age. From the guidance we've received, the insurance exchanges, which that doesn't show up on there, they can increase the cost with age. So it makes us a little bit of a disadvantage as the employer, as we can't increase our cost as the age increases of the employee. So our goal, which has always been our goal, even before healthcare reform and will remain our goal, is to make our employees healthy. We want that healthy risk pool that is not going to have high costs, that is going to have controllable costs, that we can help our employees manage their health so that we can control our costs in the future. Oh, I guess I didn't realize that the insurance exchange line was on the next slide. Okay, so what does this mean as an employer? We feel as employers we're kind of uniquely positioned to help our employees understand their health care and to help them make educated decisions. We are with them every day, we talk to them every day, we have a slight amount of control over the choices they make through incentives and plan designs, etc. So our thought is, how can we as the employer help the employee understand and work with the insurance company and understand and work with their health care providers? What can we do to assist that relationship? Well, the first thing that you'll see listed there is wellness. We have a lot of programs in place that manage our risk. We have a Healthy Lifestyles Wellness program that's an incentive structure built into our medical premiums. We offer Live Healthy Hy-Vee, Live Healthy America program every year for all of our employees to participate in. I was talking with Tom Newton about the well-being assessment. We conducted that for all of our employees this year to talk to them and to learn about their well-being and how they feel about themselves and what we can do to help improve their well-being as an employer. What kind of programs can we create and develop and assist them with? We have 140 dietitians in our stores. So they not only work with our customers, but they work with our employees on understanding their health. They are trained health coaches. They can conduct biometric screenings. They can do a lot of things to help employees, employer groups, and customers understand their health in ways that maybe the healthcare provider isn't set up for right now, or maybe that isn't an advantage to have them go to a healthcare provider for. We also have NuVal in our stores, which hopefully you all have seen and love. We also partner with programs like PE for Life and the Healthy Weight Commitment out of Washington to help combat childhood obesity and to improve the health of our country as we age. We truly take our mission of making lives easier, healthier, and happier very seriously, regardless of healthcare reform, if we have it or if we don't, if we offer benefits or if we don't. We truly want to make people healthier. Prevention, I mentioned briefly that we have dietitians and health coaches in our stores. So how can we as the employers leverage that and utilize those services to help control some of the costs that way and have some biometric screenings and help people become educated about where they sit within their health and prevent some catastrophic cases down the road. Programming and plan design, basically how can we as the benefit plan structure our plan design to be the best for our employees, control our costs, and to leverage the providers that are having the best outcomes and that will work the best for our employees. And then financial commitments. As I mentioned before, we do spend millions on our benefit plan, and we want to keep spending millions on our benefit plan. We want to offer benefits to our employees. We want to stay in the game and make sure that our employees are taken care of and that we're comfortable with where they're at. We believe it's the right thing to do. So the passage of healthcare reform legislation will produce new opportunities to creatively review how you influence risk and invest corporate dollars in your employees' health and healthcare costs. So as the employer, what can we do to creatively help our employees understand their risk, maybe negate some of the risks that they aren't aware of, and then help control the costs for everyone as we move forward. This final slide that I have here just shows kind of a timetable of what we're doing within our benefit plan to prepare for 2014 and to prepare to make those decisions of whether we're going to pay or play in 2014. And what you'll see is, in 2011, there are certain things that we have to change, that we need to adjust, and we're prepared for that. And we are continuing to build a healthier risk pool. That's our goal, our Healthy Lifestyles program. We change it every year. We make it a little tougher to earn that incentive, to get more skin in the game, you could say, of our employees so that they understand how their money is being utilized. And then in 2012 and 2013, we're just going to continue to look at guidance, look at the regs as they come out, read through them, decide how do we need to adjust our benefit plan design and make changes to accommodate those changes in 2014. And then in 2014, hopefully, our decision will be to continue to offer benefits. We will compete with the exchange. We want to make sure that our employees are getting the best benefit that they can for their money. And again, just continue to try and attain and retain the healthy workforce, and to attract employees and keep them with our company.